Hi everyone, my name is Terri. I am one of the co-founders of Little Kaktus Co, and I am also a registered dental hygienist. So a couple weeks ago on Instagram, I posted a question asking all you moms out there if you had any questions about caring for your child's teeth. So today I am going to try and answer them to the best of my ability. So your baby's first tooth is going to erupt around 6 months of age, and it will continue to erupt to about 2.5 years. It is really important to try and keep babies' teeth healthy because not only do their teeth help them with chewing, but also proper speech pattern development, and it holds the space for their adult tooth to come in the future. Before your baby's first tooth, you should still be cleaning the mouth after each feeding. What you can do is use a clean cloth, run it under some warm water, and then just sweep it along the cheeks, gums, and tongue. This is important because your baby's immune system is underdeveloped, so he or she has a higher risk of developing thrush, which is essentially a yeast infection. When your baby's first tooth starts to erupt, then that's when we can start whipping out fun things like baby toothbrushes. What I first used was a little finger brush for Jack, and it was nice and gentle and soft, and he could chew on it because that's what they love doing when they're teething. And you can also start to upgrade to a baby toothbrush if they can tolerate it. I was asked what kind of toothpaste I recommend for your child. In the very beginning, starting at around 3 months of age, that's when I started using a xylitol toothpaste. Xylitol is a natural sugar, and how it works is that the cavity-causing bacteria, they love sugar. That's what gives them energy, right? And when we have xylitol in the mouth, they're like, oh, awesome, there's a bunch of xylitol inside. And they start eating it all up like a big xylitol buffet. But little do they know is that they don't get any nutrients from xylitol. So they get really full and then they die. So xylitol is safe for humans, like our babies and us, to consume. And it's a really good starter toothpaste because it just gets, some kind of flavor in their mouth, and they might enjoy toothbrushing a little bit more. Now that Jack is a little bit older and he's not just sucking on a toothpaste, I started using a fluoride toothpaste. So you can get any fluoride toothpaste as long as it says anti-cavity on it and it's for kids. So this is from Gum Brand and this is from Crest. And what I do is I put the smallest amount, maybe a rice grain amount of fluoride onto a very soft baby toothbrush. And yeah, then I go ahead and brush his teeth. He seems to really enjoy it. And after I'm done brushing, what I do is I sort of lean him over a sink and I sort of splash water into his mouth because I just want to rinse out any extra paste that was left in there. Because babies aren't really good at spitting right now and they might swallow some of the toothpaste, that's why we recommend you only use a rice grain amount, because fluoride, it can cause a tiny bit of an upset stomach if they eat too much. So this amount would be fine. I know there's a lot of a fluoride debate going on. Parents are like, I heard it's toxic. I don't know. This is something that you need to choose yourself. Fluoride has been shown to be safe for many years and very effective in strengthening the enamel. So when you think about your own health history, like, do you get a lot of cavities? Has your child already gone to the dentist and the dentist already saw a few cavities starting? Then fluoride might be something that's really beneficial for your child to start using. So how fluoride works is that it's a topical application. So for it to be effective, it needs to be sitting on the teeth. So that's why it's in the form of toothpastes, rinses. But when you ingest fluoride, like if say you had a fluoride chewable tablet, which used to be really popular a long time ago, those are great if you don't swallow it right away. So if your child is chewing on the tablet and they're just letting that mixture to sit on the teeth for a minute or so, then that will be super beneficial. But if they're chewing that tablet for 1 second and then just swallowing it, then they aren't gonna get much of a fluoride benefit. So that's why we recommend, using a toothpaste or a rinse, or if you are gonna use the tablet, let it sit in your child's teeth a little bit longer and they can either swallow or they can spit it out if you'd like. We do recommend that you should clean your baby's teeth or your child's teeth after each meal, but realistically that doesn't happen, coming from a mom myself. So what I got here were baby tooth wipes. There are a lot of brands out there, but this one's from Aliva and it has xylitol in it. There's no fluoride. And what I do is after lunch, I just whip out one of these sheets. I'll take one out. I can use it on myself. And they just look like these little moist sheets that have xylitol on it, and then you just sort of rub the teeth after they're done eating. Make sure you rub, clean the tongue, etc., and wipe actually the inside of the cheeks as well. I'm not going to do that on me, but it tastes fine. Just tastes a little bit sweet from the xylitol, and it's well tolerated by Jack. A little other questions I had was, why is it bad for your baby to have a bottle or a pacifier too long? It's all about the development of their oral structures. A bottle and a pacifier can shift the teeth. So when you drink out of a bottle, they are using a different motion. So when they drink out of a bottle, they're actually thrusting their tongue and making a sucking motion. And when you thrust your tongue, you're pushing it against your front teeth, and it can cause your teeth to shift forward. And that's something we want to prevent. It can also cause an open bite if they constantly have a pacifier in their mouth. Just an object that is constantly in their mouth will shift the teeth. So I transitioned Jack to a sippy cup pretty quickly. I like this one because it's a spoutless sippy cup, and it doesn't have a straw or anything for them to suck on. This will help mimic better how to drink out of a cup properly, and will promote, healthy development of their oral structures. Also, last but not least, flossing is super important. I just use these dental sticks, and it helps me just access a little bit better on some of the back teeth. It's important to floss your child's teeth because bacteria like to grow right in between the teeth, and that's usually where the cavities like to start. If your baby's teeth aren't touching and they're spaced out, it's still important for you to sort of practice and put it in their mouth so they just get used to it, because eventually when their adult teeth do come in, their teeth are going to be more closely spaced together. So I think I covered all the questions that were asked. They were all really good questions. And if you have any more, feel free to message me, and I would love to answer anything I can. I will link below the website for the Canadian Dental Hygiene Association, where you can find more resources on oral care, nutrition, geriatric care, how to care for your own teeth. So feel free to visit the site, and if you don't find what you're looking for, message me and I will try my best to answer more questions. All right, until then, see you guys at the next video.